So
Mm-hmm.
I'm just gonna share my screen and let's get started.
Mm-hmm. Mm-hmm.
So, as you know, every interview begins with one question, right? Which is, can you tell me something about yourself? Right? So, can
Mm-hmm.
you try this once before we get into the
Okay.
specifics?
Mm, yes, my answer would be I'm a midwife, and I have been working as a midwife over 20 years at a private hospital in my hometown. And I'm experienced, highly experienced in taking care of high risk pregnancies and giving birth, normal birth.
Yeah. Yes, so exactly. And you have delved more into the professional side, but we should never underestimate the personal side either. Okay, so yes, exactly as you said, when we
Mhm,
are
mhm,
introducing ourselves, we should provide a brief professional summary, highlighting any relevant experience as well as your qualifications. So feel free to talk about your qualifications as well. And you can also mention your
mhm,
passion for nursing and also what brought you to this field. Right? Usually we don't think about these things
mhm,
when we are introducing ourselves. So basically, this has to go on for about 2 to 3 minutes. So when they ask you, so we should be ready in answering this for about 2 3 minutes. And I'm going to tell you what all we can cover when we are asked this type of question. Okay. So the first thing is you can talk about yourself. So of course, start with your name, and then you can talk about your status. Like, are you single? Are you married? Do you have any children? You know, if you're living with any family members. So you can start with that personal aspect. Then we can talk about where you're from and where you live, right? That's also a big part of who you are. So let's go there. After that, we can slowly delve into the professional front, and you can say how long you have been a nurse and also the different departments you have worked in. For example, you told me that it's the midwifery department that you primarily work in. If suppose you have worked in other departments, you could mention that as well. It will make the person interviewing you also realize that the scope of experience and how your experience spans different departments, so that will give them a good impression. So let's mention that as well. Then you could also, whatever your current job would be or the latest job would be, you could briefly outline your daily duties. That throughout the day, what all do you, engage yourself in? What are your responsibilities? So that they can also understand that, okay, yes, this is matching our profile a lot because we also expect this nurse, this midwife to do the same when we have them on board.
mhm,
So that's why this is important. And lastly, you can appreciate the opportunity to be interviewed. That I really appreciate the fact that
mhm,
you are interviewing me today, right? So always you could even start with
mhm.
this appreciation. That thank you so much for having me today. I am really delighted at this opportunity. And then this is how we can begin. Okay, so let's give it a try again. So, based on this pattern that I told
Mhm,
you, could you try now? How would you
mhm.
introduce yourself?
Yes, I try. Uh, mm, uh, I'm Fatima, and I'm married. I have two children, and I have been working regarding my professional experience. I've been working as a midwife, and recently, and also I have been uh, working as a supervisor since 2017. And I would be appreciate I appreciate to work in the UK. Uh, mm,
Yeah. So that's
uh,
okay. You can also look at
thank
this.
you for your time
Yeah, good try.
and
Already there's an improvement that I
okay,
can
okay.
see. Very good. Yeah, so these also the content that I'm sharing with you, I'll be sharing this after
Mhm,
the session also. So initially, you can try looking at these pointers and trying to introduce yourself. So you can look at it,
thank
okay, that Or yes, I'm married, I have children. You skip the second part. So it's
Mhm.
important that we mention where are we from, where do we live currently. And then, as you said, you mentioned the year you started working, and that's perfect. It's more impactful. So
Mhm.
you say that I've been working since 2013. So that means I've been working for a decade,
Mhm.
for 10 years. I think it's more impactful that way. So you could mention that as well. And the different departments that you've worked in, talk about that. And then also, like, what all does your job entail? What happens? So can we talk about this a
Mhm.
little bit? Could you tell me what are your daily duties when you work as a midwife?
Mhm. Mhm. My daily duties includes taking care of mothers and taking care of um, mm, uh, um, vital signs, assessment of fetal well-being and healthy, as well as giving birth, assessment and identifying of a high risk pregnancy, identify of malpresentation, mal position of fetal, and it applying pain relief, multiple pain relief, as well as performing CTG, cardiotocography,
Yeah,
and
so
etc.
much to cover, right? So I'm giving you a
Okay.
homework. I want you to write all your daily duties. Okay?
Mhm.
And then
Okay.
when we
Okay.
have the next session, we will start from this, that you will start by telling me about yourself. So these five things, I'm going to
Mhm.
share them with you. So try writing them down, and then you will notice that later on it will come very naturally to you. Okay?
Mhm.
So, yes.
Mhm. I would like to know, is it necessary I include all of my duties or
Oh,
responsibilities
I would say the
in
most
this?
significant ones, which you feel would be
Mm,
most impactful. That is why you could bring it in the class, and we could even discuss that which ones would be the most important and significant ones to
mhm,
mention. So we could have a discussion about
mhm,
it. Yeah. I would
okay.
like to show you a sample answer. This is one of the sample answers. Again, this is just like, you don't have to mimic the same way. We can modify it according to you. So, one of the nurses said this, that thank you for giving me this opportunity to be interviewed today. My name is, for example, Sanya, and I'm a registered nurse with 5 years of experience in acute care. I am particularly skilled in critical care environments, and I've been very passionate about improving patient outcomes through compassionate care and teamwork. Now, over here, of course, where you're from, etc., that is not included. That's why it's very short, but we are going to try to include it in the next session.
Mm,
Okay. And
mm,
also, a
okay.
couple of times, I want you to practice it also. Sometimes it's very good to practice it in the mirror when we are introducing ourselves. So that would be great. Yeah.
Mm,
Um,
I will try. Thank you.
yeah. Okay.
I will
Now,
try.
another aspect of introducing ourselves is also covering this. And this is another question that could come to you, that what did you like, why did you decide on a career as a nurse? Or why did you decide a career as a midwife? Yeah, so they can ask you that question as well. It could be a follow-up question to tell us about yourself. So, could you give me your answer for this first before we discuss the points to cover?
Mm, I would say, yeah, I like to help people, especially women,
Mhm.
in their exciting period of life. I like to take care of women in the pregnancy period and help them um, to be safe uh, throughout their pregnancies period.
Oh, that's so lovely. See, it has come from your heart. And now we have the base. We have a very good foundation based on what you just said. Now let's build up on it, right? So let's see what all we can include more. So we Exactly what you did. You've covered the first point perfectly. To be personal and genuine and share a heartfelt story. So right now you've told me why you're here in a bit of a crux. You can also share a story or a personal experience that inspired you to be in this department. And you can even think
Mm,
of specific moments that solidified your decision to become a midwife, right? So that's your second
mhm,
homework. I want you to think about the moments that were groundbreaking for you, that really, maybe one day when you might have successfully helped a woman deliver a baby, and maybe you also experience the same level of joy. Maybe that made you
mhm.
confirm that, yes, indeed, this is what I want to do, right? So let's try to find those. Do you have any stories like that? Any personal experience?
Uh, no, actually, I didn't have like mm, like that story, but after starting my job, I have a lot of stories about women's pregnancies, emergency situations, and like that.
Yeah, so one of them, maybe one of them where you could successfully help somebody and how it made you feel. Maybe we can discuss that further, okay? So that's the number
Mhm.
one way to answer this question. Why did you decide? So exactly how you started. So we start with that, and then we mention a personal experience. Then you can highlight your passion. What you were telling me, your passion for helping others and making a difference in their lives. And you can explain what aspects of nursing excite and motivate you. As you said, that I like to see women healthy and taken care of properly. So that is what motivates you. Maybe you could bring in a point that maybe that healthcare related to women or women's health is not talked about that much. So I'm grateful to be part of um, the team which can actually take care of women properly, especially in their time of vulnerability, like giving birth. So something like that we could discuss, right? So, and you could also show your commitment. So emphasize your long-term commitment to the profession and continuous learning, right? So you could tell them that, and it is not just till now, but even in the future, I would always like to be part of uh, the midwifery experience, and I would also keep continuing to learn more. Now, at this point, you could discuss how you plan to grow within the field and contribute. Perhaps you could say that I have been an avid reader of the research articles that keep getting generated as to how we can take care of women better. That maybe you keep reading and you are up to date on the latest developments happening in your field. So how you are already growing and how in the future also you will keep on growing in this field and contribute to healthcare. All right. That's your homework number three. You have to think of a
Mhm.
plan, right? How will you grow within this field and contribute to healthcare? Okay. So I think these answers we sometimes have to really ponder about. Only then we are able to answer this properly. Yeah. And the last one being very important, how we can connect our personal experience to the demands that the employer has. So connecting with the employer's needs. So you can tailor your response to reflect the values and mission of the healthcare facility that you're applying to. So this means, like, of course, doing a little bit of research wherever you're applying, that what are their motives, what are their goals, and how your goals are aligning with their objectives. So that again would be quite important, right? So this would be a perfect close to this question. Like if they ask you, why did you become a nurse?
Mhm.
So starting with our own experience, our passion, commitment to grow in this field, and then how it connects to their motive. That would be important. Okay, so for this
Understood.
question also, let's have a look at how
Mhm.
we could give an answer. Again, these are just so that you get an idea. Ultimately, you will be personalizing it based on your experience. So, for example, a nurse can say that I've always been drawn to the healthcare field But my decision to become a nurse was deeply influenced by, now you can say, by seeing the state that the women's health is in, and or maybe, uh, knowing that I could be part of this field, it cultivated a deep sense of empathy and compassion in me. And then you can talk about one defining moment when I noticed that how much of a need maybe the patient was in, or how kind another midwife was to somebody, right? So here, a nurse has written her experience that there was another nurse that I noticed who was very patient, very kind to an elderly woman, right? And seeing her ability to comfort and care was very inspiring. So along the same lines, you could frame something. And that's when I knew that I want to do the same and I want to make a similar kind of difference or an impact, right? So this is one of the ways of covering it. And then you could also talk about what is a rewarding part for you. Why is this a very satisfying job for you? So here, for example, this nurse had said that the most rewarding part for me is the ability to make a tangible difference in someone's life every day, whether it's providing comfort. So now instead of patient, you can say to a mother in pain, supporting her family members also during this time and educating her about her health, right? Or and every interaction being an opportunity to health. So I think this kind of a compassionate take to your everyday responsibilities is what is necessary here. And lastly, knowing that I can contribute to someone's well-being and recovery. And you have such a good thing that you can say that, bringing a new life properly in the most
Mhm.
cared for manner is the best thing I can do for a mother, right? So things like that you
Mhm.
could probably say, and that gives me profound sense of purpose and fulfillment. So then they will know, like once the recruiters know that this nurse is very compassionate about doing what she does, they are more inclined to have you on board. Yeah. And lastly, another thing is that in addition to the care that I provide, I find great satisfaction in continuously learning. So this was the learning edge that we were talking about. How will we keep developing more in our own field? Continuously learning, adapting to new challenges. I think this is a good one. The medical field is always evolving. I'm committed to staying uh, abreast of the latest developments to provide the best care. And it allows me to combine my passion with my love for science, lifelong learning, right? You can pick some things up from here. But yes, we have to remember that it shouldn't sound like we have learned it. That's why it's very important to embed what you already know with just some of the things that are written here. And as I said, I'll be sharing all this with you also so that you can get some idea, right? So what are the key things to emphasize? Just to recap, personal inspiration, like any specific people or experiences that have influenced your career choice, passion for helping others, like your dedication to making a positive impact on patients' life, continuous learning, highlight your commitment to professional growth and staying updated with the medical advancements, right? Any techniques, etc., that you can think of, and alignment with your employer. So you have to like tailor your response in such a way that it is aligning with the values and mission of the employer wherever you've applied. Yeah, so these are the things that you have to emphasize. Yes. Yeah, any questions that you have for me at this point?
No, no, thank you.
Yeah.
Everything is clear.
So, yes, these are the two questions that we have been able to cover today. Tomorrow, we're going to continue more. Yeah. And I'm going to
Mhm.
share this with you. And you have a lot of homework, a lot of self-reflection to think back and understand why it is indeed that you became a midwife. Yeah. So let's
Mhm.
revisit this again tomorrow and try practicing
Mhm.
this after I send you the pointers. So we will start with your introduction, and I'm also going to ask you why did you decide a career as a midwife or as a nurse? So let's
No
progress
problem.
from there. Yes? Okay. All right then. Great.
Yes, yes, thank
That
you.
would be it.
Thank you.
I'm going to see you tomorrow.
Yeah, thank
That day two of preparation.
you.
Thank you, Fatima. It was lovely
Thank
interacting
you.
with you
Thank you.
again. Thank
Thank
you.
you.
Bye. Have a
Thank you.
good
Bye
day.
bye. Bye bye.